I want to share some information about spinal decompression therapy and how it might relate to herniated disc issues. And this is really fascinating when you understand the science behind it. So let me start by explaining what happens with a herniated disc. Between each of your vertebrae, which are the bones in your spine, you have these special shock absorbers called intervertebral discs. Each disc has a tough outer layer and a soft jelly-like center inside. When a disc herniates, that soft center pushes through a tear in the tough outer layer. It's kind of like when you squeeze a jelly donut too hard and the filling squirts out. This escaped material can press on your spinal nerves and cause pain, numbness, or weakness in your back, arms, or legs. Now here's where spinal decompression therapy comes in. Now this treatment uses a special computerized table that precisely stretches your spine. But this isn't just any ordinary stretch. It's controlled by sophisticated systems that can actually detect when your muscles tense up and adjust accordingly, which is pretty remarkable when you think about it. When you're lying on the table, the computer creates what's called negative intradiscal pressure. Normally, the pressure inside your discs increases when you're sitting or standing, but the decompression machine can potentially create negative pressure inside the disc, working kind of like a vacuum effect. This negative pressure might help in several ways. It could potentially help draw that herniated material back toward the center of the disc. Imagine using a straw to suck the jelly back into the donut. It might also create a pressure differential that draws in fluid, nutrients, and oxygen to help with the healing process, like a sponge soaking up water after you squeeze it. And it could potentially trigger certain cellular processes that help repair disc tissue. The decompression forces are typically calibrated to your individual body weight. For herniated discs in your lower back, practitioners might position you at specific angles to target that particular area. For disc issues higher up in your spine, they use different positioning techniques. The treatment usually alternates between periods of stretching and relaxation. This pulsing pattern is designed to prevent your muscles from going into protective spasm and allows for what practitioners call maximum decompression effect. Most treatment plans involve multiple sessions over several weeks. During the early phase, people often report that pain starts to decrease. In later phases, there might be some structural changes happening. And that's great news. And the final phase usually focuses on strengthening core muscles. Oh, and by the way, the core is the core of the problem for most people. This helps protect your spine going forward. One of the appealing aspects of spinal decompression is that it's non-surgical. There's no cutting or removing any bit and pieces of your spine. But here's what I really want you to remember. This approach isn't right for everyone, and individual results can vary quite a bit. Some people respond really well to this type of treatment, while others might need different approaches entirely. So that's essentially how spinal decompression potentially works. It uses precise, computer-controlled positioning to create a gentle vacuum effect that might help encourage herniated disc material back toward where it belongs and potentially promote natural healing processes. Lastly, so I also must emphatically say this, success rates can be incredibly high with this treatment, but here's the kicker. That success really comes down to two critical factors. First, we have to make sure the patient is actually a good candidate for this type of therapy. Not everyone is, and that's okay. It's not for everyone. And second, and this is huge, the practitioner's skill level and their deep understanding of how the spine actually works makes all the difference in the world.